Ever wondered how your diet impacts your risk of cancer development? I know I have. It helps me decide what I eat every day. According to the National Cancer Institute, results of epidemiologic studies that compare the diets of people with and without cancer have indicated that people with and without cancer differ in their intake of a particular dietary component, which indicates that various dietary components can be associated with the change in cancer risk. Interestingly, diet has also been frequently hypothesized to influence the risk of bladder cancer since carcinogenic food compounds are stored and excreted via the urinary tract. Since the renal system is responsible for preparing the blood to maintain acidity homeostasis, it has been speculated that the acidity of one's diet has a crucial impact on the health and functionality of these organs. Thus, research suggests that a high alkaline diet with more fruits and veggies may be a great way to help balance urine and blood pH levels. As a result, we speculate that acidic diet leads to acidity in the renal system, which in turn produces acidic urine that is stored in the bladder, which can increase one's risk of bladder cancer. Research also indicated that consistently acidic urine of pH less than or equal to 6 was associated with an increased risk of bladder cancer, with an odds ratio of 1.5 and a 95% CI from 1.2 to 1.9. To test our hypothesis, our team plans to test the correlation between vinegar consumption and bladder cancer risk, since vinegar consumption leads to increased acetic acids, which can potentially disrupt excretory homeostasis, thereby increasing the risk of bladder cancer. In order to perform this case control study, 5 hospitals at the regional referral centers for bladder cancer were recruited. Cases are defined as biopsy-diagnosed bladder cancer patients who consent to participate in the study, and cases are each matched with 3 non-cancer controls. To ensure similar environmental conditions, healthy controls will be obtained by asking the physician who referred the bladder cancer patient over to provide 3 non-cancer patients who also present themselves to the hospital the physician is a member of within a week of the bladder cancer case. The controls will also be matched by zip code within the 50-mile radius, age within a 10-year strata, as well as biological sex. 133 bladder cancer cases and a total of 1,332 samples, we can detect a minimum OR of 1.5. Data will be collected via video call interviews in which participants are asked to estimate the amount of various seasonings, including vinegar, they consume weekly on a scale of 1 to 10. They'll also be asked to estimate their intake of various drinks, including vinegar drinks, and form a list of 10 favorite dishes in their weekly consumption for vinegar estimation. Period and adjusted OR will be computed to adjust for age, subject weight, education level, insurance type, dietary restrictions, alcohol consumption, and smoking status. P-value per trend will also be computed to assess the presence of dose response with vinegar consumption.